Hey, it's Dr. Rosenfield again, and today we're going to talk a little bit about a subspecialty within gynecology that we are calling intimate wellness. I can't take credit for it. This is something that a few of my colleagues across the country have come up with as a great header to talk about this subcategory within gynecology medicine that includes both surgical and non-surgical components. So the surgical stuff we've talked about previously, labiaplasty, which would be a cosmetic operation on the external genitalia, mostly for appearance, but also for function. There are women with elongation and thickening of the labia minora, maybe sagging of the labia majora, that functionally becomes problematic in things like spin class or Pilates, trying to ride a bike, trying to ride a horse, or even with intercourse, where the elongated labia can pull and tug and create some unpleasant sensation. And for many women, it's just simply a matter of cosmesis, where they haven't liked the way things have looked for a very long time. A lot of our patients really have been dealing with trauma since they were teenagers, where they just felt that things didn't look right or they weren't happy with their appearance. Now, we do recognize there's a tremendous bell curve on what is considered normal, but we also embrace the fact that people do have the right to make decisions about their own personal health and their own personal appearance, and we think it's really important to support those things. Labiaplasty can be performed in a couple of different techniques, but the best technique is really one where reconstruction is used rather than just amputating the outer part. I think that leaves a very unnatural appearance. When we do reconstruction using a modified wedge technique that was first described by Dr. Gary Alter, who wrote a paper about this, the results are just there's no comparison. Feel free to hop on realself.com and look at our before and after photos there. For vaginoplasty, that's really a surgical procedure that has a goal of reducing the genital hiatus or tightening the vagina. This is something that is most commonly used for women that have had multiple vaginal deliveries or have had a traumatic vaginal delivery where the opening of the vagina has become significantly larger. Some patients that have this problem also have issues with both defecation or urination, but there are many women out there that don't really have any symptoms of the prolapse as much as they just have a significant laxity in the vaginal tissues. So as we talk about vaginal laxity and urinary incontinence and post-childbirth problems, there's also some non-surgical solutions. So traditionally, we like to send patients to physical therapy. We consider hormone therapy, hormone topically in the vagina can also be helpful. But for some patients, it's just simply not enough, or they don't have enough time, or they've tried the Kegels exercises, they've tried physical therapy, they're just not getting where they want to be. FemiLift is a fractionated CO2 laser treatment that we can use inside the vagina. There's other companies that make lasers. One of them is called the Mona Lisa Touch. There's a couple others out there. They're all pretty similar. The idea is taking a CO2 laser, which is the description of the type of gas used to help with the laser. Laser is, as most people know, light amplification that allows for the focus of a beam of electrons, essentially, that can burn, cut, and coagulate tissue. When we use a laser and we hit it against a mirror, it becomes a fractionated laser beam. And what happens is the power density of each of the beams becomes a lot smaller. And therefore, we can do things like do laser skin resurfacing. A lot of our patients are familiar with that from going to a dermatologist or a medical spa. But these new techniques use the same type of laser and deploy it inside the vagina. So people may wonder, well, why would we ever do something like that? And the reason for it is because the vaginal mucosa, which is the lining of the vagina, very similar to the lining of the mouth, actually, if we hit it with a laser, especially a fractionated laser, it can allow for a sloughing of the first layer of tissue, and then tissue healing occurs. And that tissue healing is really what allows for a true rejuvenation of the tissue. Patients that have the FemiLift procedure typically have a few problems. One of them is urinary urgency, the sensation of needing to urinate frequently, potentially not wanting to go on long-term medications that can have a lot of side effects and can be quite expensive. The other thing might be laxity, and when used, the laser can allow for a tightening of the vagina. and also can be used for increased lubrication and better sensitivity. So it's a lot of potential upsides for using the laser. Now, the laser can also be used in conjunction with platelet-rich plasma to do something called the Leo procedure, or laser-enhanced procedures. This can be used in conjunction with platelet-rich plasma to help with sexual function as well. We'll get into that in a moment. So the first one, again, is the CO2 laser, and that is a superficial, not very deep treatment inside the vagina, 3 treatments, 3 months apart. And we've seen some great results with that. And again, I would encourage you to look online and read about it. The second procedure is VIVEV, V-I-V-E-V-E. And VIVEV is a radiofrequency treatment that is used for deeper tissue. So we've got the CO2 laser for the first layer. And then if we want to go deeper, we use the radiofrequency. Radiofrequency is a different type of wavelength of light, essentially. And what happens when you use radiofrequency is that you can get to a deeper penetration in the tissue and help with tightening at that deeper level. So the combination sometimes of the laser for the surface and the radiofrequency for deeper can be a great combination for certain patients. What's interesting about VIVEV is that it has a cryoprobe, which is basically using a coolant to cool the superficial layer, which is where the FemiLift would work, and allow for a deeper penetration of the radiofrequency energy to get the temperatures to elevate to a point that is high enough where we can get regrowth of collagen. And that's essentially what we're looking to do for laxity. So VIVEV, deeper treatment, one and done. So it's a single treatment, takes a little bit longer than the FemiLift. FemiLift is just a few minutes. VIVEV is about 15 minutes, 30 minutes potentially of treatment time. And then the final product is the platelet-rich plasma, which is really cool because it uses your own body products. So you're basically having the physician draw your blood, spin it down in a centrifuge, take the red stuff out, where you're just left with the yellow products, which is the plasma. And the plasma has a high density of platelets in it. Well, when you activate those platelets, you can do things that so platelets are typically used in wound healing. Most people are familiar with that. You cut your skin, platelets go to that area. They help with clotting. They also help with tissue healing. And when platelet-rich plasma is used to inject in various parts of the body, it can accelerate healing, but it can also lead to some really interesting results when used in the female genital system. So if you want to read about it, I would recommend looking up the O shot, which is when we take platelet-rich plasma and we inject it into the clitoral shaft or into the suburethral space along the front anterior wall of the vagina. You might ask, well, why would anyone ever do that? And the answer is quite simple, because when we put the growth factors into those areas, we get a increased response with this kind of idea of rejuvenation. And what can help is we can get new nerve growth, we can get better vascularization or blood vessel growth as well. And for women that have a difficult time with sexual response, with clitoral stimulation, or perhaps they haven't been able to find a spot inside the vagina with a higher sensitivity, sometimes called the G-spot, Grafenberg spot, after a famous gynecologist that denoted this area, which is really the area just along the urethra inside the vagina. And that area has a fairly high density of nerve fibers, and if we add platelet-rich plasma into that area, we basically stimulate more growth of those fibers and potentially can increase and make the sexual response faster, better, and possibly more powerful when it comes to orgasmic function. So lots of interesting stuff, and these things can be used in combination with one another as well. So again, this is all part of this idea of intimate wellness and this concept of something that's very personal and for many patients is very private, but we've got all these things that we can do now in gynecology to help our patients achieve the results they're looking for, either surgically or non-surgically. We can use more traditional medicine, physical therapy, surgical procedures, or these more innovative, newer procedures that don't have as much data out there behind them, but people are looking at and very excited about the outcomes, including our patients. So feel free to please reach out and contact us if you have any questions. Those questions can be regarding the procedures themselves, the pricing of the procedures, which things are covered or not covered by insurance, or simply if you have questions about them, we're happy to always answer. Thanks a lot. I hope that was helpful.